Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Hannah Brown, who is a hospitalist at Baptist Health. Welcome.
Thanks for having me.
Now, I use the term hospitalist. You've been around for several years, but some people don't recognize that term or what it is. Tell us what a hospitalist does.
So what I tell my patients is I'm like your primary care doctor while you're in the hospital. So we have similar training to what most of the primary care physicians have, either did residency in internal medicine, family medicine, and sometimes pediatrics also. So basically, back in the olden days before hospitalists.
Back when I was rounding at the hospital.
You had to leave your clinic and come see your patients in the hospital, and that's pretty disruptive to seeing patients in clinic. So now our primary care doctors don't have to leave their clinics. We kind of take over that part of the care of the patient while the patients are in the hospital, and then when you leave the hospital, we turn your care back over to your primary care physician.
That's one of the benefits to being a hospitalist. You pretty much have somebody there 24 hours a day.
Right. We're able to provide 24/7 coverage to the hospital. We do admissions at all hours of the day. We receive transfers, and we're able to kind of hand off to the other providers within our group to smooth those transitions.
Now, give me some examples of things you might take care of.
So we really can take care of anything. Sometimes it requires the help of a specialist, but some of the more common problems that we see would be things like heart attacks, pneumonia, COPD exacerbations, skin infections, gastrointestinal bleeds. Those are common problems.
And you're the basic doctor that does the basic care, but you may have a heart attack that you're taking care of, but you also have a cardiologist there with you.
Right. We have the ability to determine when you actually need to be seen by a specialist. So there are a lot of cardiac problems that are fully within our scope of practice, and we don't need to see the cardiologist in the hospital. But once you're needing a heart cath, it's time to call the cardiologist in. And so I think that's something that patients sometimes don't understand. They come in for a cardiac problem, they're expecting to see the cardiologist, but there's a lot of things that we can do without involving them, and then maybe we set up a follow-up once you leave the hospital with the cardiologist.
Now, you mentioned follow-up. That's one of the things hospital does. You coordinate the care in the hospital and make sure that the records get to wherever the patient may go afterwards.
Yes, so the patients often ask me, now are you going to tell everything to my primary care doctor? And luckily we have a lot of advances in our electronic medical records, so I say it should automatically, fax these records over to them, or a lot of y'all can log in and see them, but we type up a nice summary of everything that happened in the hospital called a discharge summary, and it includes labs, imaging, and any recommendations or things that need to be followed up on. Occasionally there's something that's so complex that I do need to reach out and speak directly to the primary care provider, and so I'm able to do that as well.
And the other side of that, the primary care doctors can call you and talk to you about what has gone on with that patient.
Exactly, and because you all know the patients the best, right? I'm only seeing them for a short period of time. You know them long term, so you have a lot of background information that you can share with me. And sometimes there's patients that require hospital admissions frequently. When you know they're definitely going to need to be admitted to the hospital, there is occasionally the option to even bypass an ER visit, and you can call us and directly admit the patient to the hospital.
Now, what should a patient and families expect from a hospitalist in terms of communication or care?
Well, one thing that's a little tricky for me is that I don't have a schedule of appointments throughout the day. So I walk in at 7 a.m. and I may have 22, 23 patients that I have to see. So sometimes patients are expecting me to be there at 8 o'clock in the morning in their room, and I can't be in 23 patients' rooms all at once. So you'll tend to see us kind of come by throughout the day, and we have the ability to triage who we see in what order based on what the patient needs. So I'm going to prioritize unstable patients and patients that have time-sensitive needs, and then my more stable patients I might save until later in the day. Sometimes that means, you know, my visit may not coincide with when a patient's family is there in the room, but if they're not hearing from me and they feel like they need that update, I always encourage them to reach out to the nurse to ask me to give them a phone call later in the day, or I will try to reach out and make that phone call if I know that the patient is not able to relay that information to their family.
Well, that's great information. We appreciate all the care you give the patients and the information you give back to the primary care docs. Thank you so much.
Thank you.
We'll be right back.